This demonstration video offers you help and guidance for injecting with the Humira Pen. Watch it and read the entire patient instructions for use found in your Humira package. Don't try to inject Humira yourself until your doctor has decided you can, and you've been shown the right way to give injections.
Hi, I'm Sarah. I've been taking Humira for a while now. I have to admit, at first I wasn't so confident about injecting. But with a little help and practice, it's become part of my routine. And now here I am, about to show you how. You may think, will I get this right? I'm here to help you with the process. And of course, you should call your doctor with any questions you might have. Even though a healthcare professional will provide your initial instruction, consider this a refresher. Feel free to watch as many times as you like. Okay, I'll break this down into steps for you. I will also give you a recap based on 4 quick tips found in your Humira package. After I wash my hands, I'll gather the items I need and place them on a clean, flat surface. I've got my alcohol swab, a cotton ball or gauze pad, a sharps container, and my Humira pen, which I've taken out of the refrigerator. If it's more comfortable for you, leave Humira at room temperature for 15 to 30 minutes before injecting. You'll want to do this in a well-lit place in your home where you feel relaxed and have some room. I always check to make sure the medicine hasn't passed the expiration date. And also, make sure that it's not frozen, even if it's been thawed, and that it hasn't been exposed to direct sunlight. If it has, I won't use it. I'll use another pen in my fridge and call my pharmacy. Now, I'm going to inspect the pen. There's a gray cap, number 1, and a plum-colored cap, number 2. Holding the pen with the gray cap pointing down, I make sure the liquid inside the window is up to or close to the fill line. Then, I turn it over so that the gray cap is pointing up to check that the liquid is clear and colorless. It's okay to see a few bubbles. But if you don't see the full amount of liquid, or if the liquid is cloudy, discolored, or has flakes or particles in it, don't use it and call your pharmacist. Right now, I'm going to inject myself on the front of my thigh. The other site you can use is the lower stomach area. If you choose the lower stomach, make sure it's at least 2 inches away from the belly button. Each new injection should be at least 1 inch away from the site you chose the time before. And my doctor said not to inject into skin that is sore, bruised, red, hard, scarred, raised, thick, has scaly patches, lesions, or stretch marks. And to be sure not to inject through clothing. With clean hands, I wipe the spot I'll be injecting with an alcohol pad, careful not to touch the area again. Pick up the pen with the gray cap pointing up. I hold the middle of the pen with one hand so that I'm not touching either of the caps. With my other hand, I'm going to pull that gray cap straight off without twisting it. The small gray needle cover inside the cap should come off along with the cap. You don't want to recap the pen, and be careful not to touch the needle. If a few drops of liquid come out of the needle, no problem. Now, from the bottom of the pen, I pull the plum-colored cap straight off, which will reveal a plum-colored button. I flip the pen so that the plum-colored button is now pointing up and hold it so I can see the window. I'm still not pressing the button just yet. Now, I'm just about ready to inject. If you're a little nervous, that's to be expected. I find that taking a deep breath at this point definitely helps me. With my free hand, I'm going to gently squeeze the area of skin that I've cleaned and hold it firmly. I'll place the white end of my pen straight at a 90-degree angle and flat against my skin, then I'll press the plum-colored button. The loud click you'll hear signals the start of the injection. Now I continue pressing the button and holding the pen against my skin for 10 seconds to make sure that all of the medicine is injected. I know the injection is finished when the yellow marker in the window has stopped moving. And then I pull the pen away from my skin. The white needle sleeve will move to cover the needle tip. make sure you throw away the pen immediately into a sharps container. Don't rub the injection site. Instead, gently press the gauze or cotton ball for 10 seconds. There may be a small amount of fluid or a drop of blood, which is normal. At the injection site, there may be redness, rash, swelling, itching, or bruising. If it doesn't go away within a few days or gets worse, call your doctor right away. All right, we're just about done. Use the FDA-cleared sharps container, not your household trash, for your used pen. And of course, it's important to keep the container out of the reach of children. You can request a new sharps disposal container at no additional cost from the Humira Sharps Disposal Service. When the container is about 2/3 full, request a new container. Remember, do not throw away the pen in your household trash and do not recycle your used sharps container. If you don't use the Humira Disposal Service, follow your community guidelines. For more information about sharps disposal, go to the FDA website www.fda.gov/safesharpsdisposal. Okay, that's it. If you have questions at any time, just pick up the phone and talk to a Humira registered nurse or call your doctor. I find it helpful to use my phone to keep track of my injections. I also make notes in my calendar so I can remember when and where I've already injected.
Common side effects of Humira include injection site reactions, redness, rash, swelling, itching or bruising, upper respiratory infections, sinus infections, headaches, rash, and nausea. These are not all of the possible side effects with Humira. Tell your doctor if you have any side effect that bothers you or that does not go away. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. If you cannot afford your medication, visit www.pparx.org for assistance.
Even after you've learned how to inject from a healthcare professional, it can be hard to remember all the steps when you start doing it at home. A helpful way to remember is by following the 4 Ps from the Quick Tips Guide, which you'll find inside the Humira package. First, pick an injection site and with washed hands, wipe it clean with an alcohol swab. Next, pull the gray cap and then the plum-colored cap off the pen. Once you squeeze the area of skin that you've just cleaned at the injection site, place the white end of the pen on the raised area of skin at a 90-degree angle. And finally, press the plum-colored button until you hear a loud click and hold the pen firmly in place for 10 seconds. Remember to review the complete patient instructions for use included inside the Humira package before giving yourself an actual injection. I hope this video helps you become more comfortable with this.